Hello, my name is Francisco Chávez, and today I'm going to talk about empagliflozin and progression of kidney disease in type 2 diabetes. Introduction. Type 2 diabetes is a major risk factor for macrovascular and microvascular disease. Kidney disease develops in approximately 35% of patients with type 2 diabetes and is associated with increased mortality.
About 90% of people with diabetes have type 2 diabetes. If you've got type 2, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 2 diabetes, your body still breaks down carbohydrate from your food and drink and turns it into glucose. The pancreas responds to this by releasing insulin. But because this insulin can't work properly, blood glucose levels keep rising, so more insulin is released. For some people with type 2 diabetes, this can eventually tire the pancreas out, meaning their body makes less and less insulin. This causes even higher blood glucose levels. So what does this mean? Well, as your body can't get enough glucose into your cells, a common symptom of type 2 diabetes is feeling very tired. Other symptoms include needing to wee a lot, feeling extremely thirsty, cuts and grazes healing slowly, and getting infections like thrush. A lot of people don't get any symptoms or they don't notice them. Some people don't think the symptoms are important, so don't ask for help. This means that people can live with type 2 diabetes for up to 10 years before being diagnosed. And over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the effects of diabetes and high glucose levels can be managed. So if you've got any of these symptoms, see a doctor as soon as possible. There are different ways of treating type 2 diabetes. Some people can manage it by healthier eating, being more active and losing weight. Eventually, most people will need medication to bring their blood glucose down to a safe level. Whatever the treatment, everyone with type 2 diabetes needs to learn how to live with it. We help people do exactly that. Take a look at our website to see how we can help you. Our researchers are also investigating ways to put type 2 diabetes into remission, so people's blood glucose levels return to normal and stay there. And they're finding out more and more about type 2 diabetes, so that we can do more to prevent it, find new ways to treat it, and one day find a cure.
Applications in medicine. Empagliflozin, a selective sodium glucose cotransporter 2 inhibitor, reduces hyperglycemia in patients with type 2 diabetes by reducing the renal reabsorption of glucose, thereby increasing urinary glucose excretion.
SGLT2 inhibitors explained in 3 minutes. Let's begin. The SGLT2 inhibitors, or sodium glucose cotransport 2 inhibitors, are one of the newer medications used to lower blood sugar in patients with type 2 diabetes. These drugs can be identified by their suffix gliflozin. For instance, empagliflozin, or its brand name Jardiance, or dapagliflozin, or canagliflozin. So, how exactly do SGLT2 inhibitors reduce blood glucose levels? But firstly, what is SGLT2? Sodium glucose cotransporter 2 is a protein found in the nephrons of the kidney. Approximately 160 to 180 grams of glucose is filtered from the glomerulus into the Bowman's capsule in a day. SGLT2 is a protein in the proximal convoluted tubule that acts to reabsorb filtered glucose back into the blood. Approximately 97% of filtered glucose is reabsorbed into the body through SGLT2, and the remaining 3% is reabsorbed through another protein called SGLT1. As a result, very little glucose is excreted through the urine. As the name suggests, SGLT2 inhibitors, such as empagliflozin, bind to SGLT2 and prevent the reabsorption of glucose back into the body. As a result, more glucose is excreted through the urine, and this results in a reduction in blood glucose. So, to summarize, SGLT2 inhibitors act to decrease glucose reabsorption in the kidneys, resulting in increased excretion of glucose in the urine, and this ultimately leads to a reduction in blood glucose. Additionally, this medication may also help with weight loss, and it is worth noting that SGLT2 inhibitors do not cause hypoglycemia. Looking at the side effects of SGLT2 inhibitors, urinary tract infections and genital fungal infections, such as yeast infections, are more common in patients taking this medication. This is due to the increase in glucose in the urine, which promotes bacterial growth in the urinary tract. Some patients may also experience increased frequency of urination, and this may lead to lower blood pressure due to the loss of fluids. Some patients may also notice a slight increase in their cholesterol values, as well as some nausea.
Pros and cons. Pros. The use of empagliflozin has been associated with a lowering of glycated hemoglobin levels in patients with type 2 diabetes, including those with stage 2 or 3A chronic kidney disease, and with reductions in weight and blood pressure, without increasing in heart rate. Cons. Among the possible adverse effects that may occur from the use of this drug are dehydration, vaginal yeast infection of the penis.
The great thing about EMPA, reg outcome, it was a global study, right? It was a very well conducted study, and over 7,000 patients. And as a result, right, not only we have great primary data, but there was an opportunity to go back and keep learning from that data. So one of the two analyses that we're presenting here at ADA are focused on big unmet needs, and that is chronic kidney disease and heart failure. So let me tell you about the first of the studies, right? What we know is that when we look at EMPA, when we look at Jardiance and the benefit on new onset or worsening of renal or kidney disease, right? The effects were independent of cardiovascular risk at baselines, right? In other words, when we're talking about A1C, when we're talking about lipids, right? When we're talking about blood pressure, independent that those risks were controlled or not, the effect of Jardiance on chronic kidney disease was consistent, was positive. So that's one of the studies. The second one is that we look at hospitalization for heart failure and CV death. And at baseline, we really took a look at the different risk that the patient would have, from a low risk to high risk, and whether the effect was consistent, right, for each of those patients and across the continuum. And we observed, fortunately, that the effect of Jardiance was consistent across, whether you're low risk or you're high risk, the effect on the positive effect of reducing the risk of hospitalization for heart failure and CV death was consistent. Now, you would think, why is this important? Renal disease, right, it's a big unmet need, and 15% of the U.S. population have renal disease, and the number one reason of renal failure. Heart failure is also a big unmet need. Here in the U.S., we have almost 6 million people, and unfortunately, it's a disease that has a high morbidity and mortality. So if you think about that 50%, 50, of people that are diagnosed with heart failure will die within 5 years. So as you can imagine, it's a big unmet need, and in a way, it's very reassurance because, as you know, this is, as I clarified before, this was sub-study, post-hoc studies after Empagliflozin results. But in a way, they're very reassuring, very informative, because we are doing the CV outcome studies for heart failure, right, and also for kidney, right, the Emperor program and the Empagliflozin program. So in a way, this is something really relevant for the medical audience.
Issue applied in Ecuador. It is necessary to announce to health professionals and patients about this new risk and to inform about the necessary measures to prevent their appearance, because information has been released on an increased risk of non-traumatic amputation, especially in the toes. In conclusion, among patients with type 2 diabetes who were at high risk for cardiovascular events, the use of empagliflozin was associated with a slower progression of kidney disease than was placebo when added to standard care. Empagliflozin was also associated with a significantly lower risk of clinically relevant renal events.
The Empagliflozin study was a study testing the efficacy of empagliflozin in patients with diabetes. And for the first time after 25 years, we have a drug that showed a reduction in mortality and morbidity. But not just overall mortality, but also the occurrence of new heart failure cases. This is very important because of the safety concerns that we had with previous drugs, like the glitazons or some of the gliptins. And therefore, the results of the Empagliflozin tell us that we have a new class of drugs that can be safely used in patients with heart failure. Of course, there are new trials ongoing to address specifically the efficacy of the SGLT2 inhibitors in patients with heart failure. And the results of these studies will be important, not just to confirm the results of Empagliflozin, that seems to be also mirrored by the interim analysis of the other trials with the SGLT2 inhibitors, but also to teach us how to use friendly these drugs in patients with heart failure. One important point is that now cardiologists are empowered to treat diabetic patients with heart failure. We shouldn't leave diabetes to other specialties, and the guidelines specifically say that patients with diabetes should be supervised by a cardiologist.
Thanks for your attention.